It's recording.
Okay, so pin here, and you can feel the ASIS, and then just come a little bit more lateral. And then you pin in here, and I'm using my hip to really pin it, and then you do some vibration, and then you move it, and I'm kind of pinpointing the really tight stuff with my thumb. Does that feel?
The second one was pretty
intense?
tender.
So that's the best way to work the kind of the greater trochanter and those type of areas when you're doing the back of the leg too.
Yep.
When you can't get above the
Right there.
box.
Is that tender?
Okay.
You can press as what you were doing. I just can tell it's more tender.
Yeah, so all around the greater trochanter, there's attachments, so you can do this on every angle, because like you can even kind of come underneath and come up this way into the greater trochanter. You can do this when they're face down too. Yeah.
Okay.
So basically, I'm like on the IT band area, and it's tight. Is it pretty sore everywhere in here, or is
Not
more?
super sore, just slightly tender. There's like 2 or 3 spots that you've poked that are a little bit more so than the others. I feel nothing here.
So I'm like right at our ASIS, coming down.
A little bit there, yeah.
You kind of get into like a rock, like a flow with it. And everything's loosening up a ton right here, so you'll probably feel it when you stand up.
You can see your legs moving.
Yeah.
More.
Yeah. And then you can also do like, I don't usually do petrissage in the same way over the sheet because obviously it's like not flowing. So what I do instead is I like to kind of get a chunk of skin underneath the sheet and just kind of sink and kind of
pull on it.
yeah, and almost vibrate with it too, because you're like getting it to kind of pull away from, it's like you're loosening up the fascia. So I don't usually do as much linear friction as much as I do like kind of a deep pressure and a shake. And in the way it's like cross fiber friction because the vibration is making it move, the fibers move. So even though you're not moving this, you're still technically doing like a vibration with it. And then, yeah, I think everything else you can kind of do. Like I said, petrissage is more of like a compression grippy thing instead of a nice flowy
So
thing.
if like we were doing somebody that was closed or, you know, that had the low boxers and stuff like that, that would be the best techniques to use on that.
Yeah, and let me show you one that's, so let me re-drape. And so if they have their clothes on, like if they had pants on, I would say just undrape the blanket. And then obviously you're not gonna use oil or anything. So you can still do like effleurage.
It feels weird.
You can still do like friction. Even your petrissage is more of like a grip versus like a flowy thing.
So that's like the pressure, the grip and lift. That,
Yeah. Yeah.
Kind of that, okay.
And even on the foot, you can still like do all those things where you're moving the ankle, moving the toes. You can do some friction. I would probably use more of my knuckles in this case, just because it's better with if you can actually like pin it. You could even do gymnastics is almost easier to do because they're closed, so you don't have to worry about exposing them. So you just kind of remove the drape and just with their pants on. Hopefully their pants are flowy. Sometimes they're in jeans. Maybe just consider skipping gymnastics if that's the case.